We also really need staff to be involved. We need them to shift from task-based care to outcome-based care. So they're not simply doing a turn or changing a dressing. They are preventing pressure ulcers. We want them to look at the big picture and the long-term effects of prevention. Recognize that learning only occurs when it's been applied to practice. So if you hear them say, I know that, you need to say, but are you doing it? Are you making a difference at the bedside? Residents and families have a big part to play as well. They need to become knowledgeable consumers and be aware of their risk for pressure ulcer development or their family's risk. And being involved in developing an individualized plan of care is paramount in order to gain adherence, to make sure that they will buy into that plan, make them a part of creating it. So the PUAP program team reaches in many different areas. From administrators, families, residents, team leaders, and staff, we empower, we advocate, we enable, we educate, and most importantly, we have to mentor. Now on page 1.3 and 1.4, you have a program calendar that you need to start filling out. So if you go to Appendix B, and that would be B/1, you will see a calendar that has dates, so you can start to plan when you want to create events, like the kickoff event. Begin to plan staff educations. Discuss the initiation of patient and family educations, how you're going to do it, how often you're going to do it, etc. For staff education, initially, when you're doing your blitz for your entire agency, you need to book the space, your audio visuals, and your presenters. It doesn't have to be you. It can be your educator. It can be a dietitian. It can be an occupational therapist or a physical therapist, whoever is passionate about prevention. You need to copy the workbooks and the attendance sheet and evaluation forms that are in the back of your binder. And you have an advertisement brochure that you see here on the screen. It says Stop Pressure Ulcers Now, coming soon, but you could also write on that, because it is dry erasable, you can write the date of the next session. Set aside clinician brochures, which you have in your kit. Review the slides and individualize them as required. Yes, you can change them. And you can also talk to the changes. So if your facility has 365 residents, that's something you might want to say. You also might want to say what your prevalence and incidence is. And then prepare any additional material. Remember, once your blitz is done, this education goes into your orientation package and becomes part of the culture of your facility. Resident and family education, I recommend that this goes on a regular basis. So you might want to do this once a month, depending on your turnover of patients. You book the space in AV for the session. You advertise using the same little poster, copy attendance sheets and evaluation forms, and set aside the patient teaching brochures, which are different from the clinician teaching brochures. Review the slides and prepare the session, and add additional material as required. And again, you might rotate your staff through teaching this session. It will empower them as well and engage them in educational activities more than they're accustomed to. So as I mentioned a few minutes ago, the sustainability is based on getting this to be part of your facility. So this moves into the orientation program where it's run every orientation. The patient and family should be provided on a regular basis. Clinical practice sustainability is based on regular use of the pressure ulcer risk scale, whichever one that is validated that you're using. Plan of care needs to be based on the identified risks from that scale. Routine skin assessment on all residents, patients, or clients. Weekly rounds on high-risk patients, residents, or clients, and a monthly care review. In our next session, we'll review prevalence and incidence, evaluation, and accreditation based on the program. Thank you.